But first, when Donald Trump takes action, as we've learned, he doesn't muck around. Today, in a very aggressive attempt to dramatically slow down the spread and death toll from the coronavirus in America, he cut Europe off from the United States. That's basically what he did. The President ordered a shutdown of all travel from European countries effective from Saturday morning, our time. And not for a week, not for two, but an entire month. The nation's largest and most elite sporting organisation too, the NBA, well, they've acted at the same pace by suspending the current season of NBA. This was prompted by a Utah Jazz player being found positive for the virus. Also, today, the World Health Organization declared the outbreak an official pandemic. That will alarm lots of people, despite the fact, and this is the truth, that a pandemic is only defined as a disease epidemic which can spread across multiple continents. That happened 2 months ago, and it was called a pandemic by Australia on February 27. And of course, when the most famous actor on the planet, Tom Hanks, and his wife Rita contract this rabid influenza, well, that's destined to send the fearful and the panic-stricken into an even bigger spin. But for the vast majority of Australians, there is no reason at all to panic and no reason for fear. One, as our Chief Medical Officer, Brendan Murphy, has gone to great lengths to explain this week, this is not a virus that inflicts major symptoms on healthy people.
There is no point being tested at the moment if you have not travelled or if you've not been in contact, even if you have flu-like illnesses. But other Australians do not need testing, and all they are doing is putting an unnecessary burden on the testing.
He's made the point that the symptoms for most healthy people are very mild. Two, as the PM keeps reminding us, the total number of people who've contracted the virus is actually around half the figure frequently announced.
What we need to understand, there's just over 100 people currently in Australia have had the coronavirus. Well over a quarter of those have actually fully recovered, and another quarter are well on their way to doing that.
And thirdly, in a nation of 25 million, losing 3 elderly people, it is very sad, but an extremely positive statistic, especially considering the fact that we lose on average 1,300 people every winter from the common flu. And all this hype over shutting down public events like Easter shows in Sydney, football matches in Melbourne, Sydney, Brisbane, Perth, Adelaide and the like, all Australia's senior medical experts are saying it is unnecessary, and that is the advice they've given the federal government. Now, if you're over 70, maybe you should consider keeping a lower profile, but the PM won't be.
Well, it's very simple. You follow the health advice. I'm going to the footy this weekend. I'm looking forward to it. And I'm sure many Australians would, and I encourage you to, unless you're ill, and unless there's a reason that with your own, if you're in self-isolation for medical reasons or you're actually ill, then I wouldn't suggest you go.
The Sharks will get beaten, but at least he's going along to the football. And this is where the government needs to focus their attentions too, not just on the provision of medical services, not just on a stimulus to keep our economy above water, but in the psychological fight to keep people calm, to keep people living normally, to behave a whole lot better than they have, because we have seen some shocking behaviour that many Aussies should be ashamed of. Behaviour that has turned physical and robbed many older Australians of basic necessities. It is wrong, and I hate to use this word, but it's right, un-Australian. And this conga line of people with sniffles and coughs who are clogging those new pop-up clinics to get blood tested for what they think is the coronavirus is just madness. They won't take you, and neither should they. The sooner the federal government begins to run a calm, clear and concise ad campaign to present the facts and dispel the myths, the better we're all going to be. It is not time for panic, because panic only makes the solutions harder to achieve. And how about we stop the selfishness too? Get over ourselves, think about what the elderly need and how much more at risk they are. Just stay out of the supermarket, and how about we act like adults?